Thank you. I guess this is more of a comment than a question, and it may roll into a question or opportunity for response, but our governor says, and you have agreed, that the expansion program is not good for Texas, but if Texas's program is so damn good, why do we have the highest number of uninsured in the nation?
Because we have the highest rate of non-citizens in the country coming into the state, accessing our healthcare system.
But are all of them eligible for many of these requirements? Because the bottom line, just like education, when the state chooses not to fully fund programs for which we can get some very beneficial matches from the federal level, especially in the case of Medicaid, the costs don't go away. Our local governments are assuming costs that the state, in its efforts to look as though it has done a good job in transferring in a shell game of funds, responsibility. The state might look better, but local taxes go up when school issues happen, and in the case of Medicaid and costs to our for uncompensated care in our local emergency rooms, local taxpayers are paying for it.
Totally don't disagree with you. I think that's why while we put the fiscal bill put together, even in spite that we have a policy right now of not expanding the Medicaid, you need to look at the numbers. You need to look at the federal number. I guarantee you, if I was a county hospital district, I'd be knocking on your door saying, you need to redebate this issue. Maybe want to look at a local option or something or whatever. I don't know. Because they are going to get the ones left with the large number of uninsured.
Commissioner, when we were talking about, when I made a statement about Texas having the highest number of uninsured, you said the reason it was the highest number was because we had a large population of immigrants in comparison, our population of uninsured in comparison to other states. I'm assuming that you have charts and numbers of how Texas compares to other states.
We sure can get those to you, sir.
And can you give it to me as well, broken down with and without our immigration population and other states' immigrant population? Because since you and I talked, I had a chance to look it up, and even with pulling out Texas's immigration population and leaving in the immigrants in all other states, Texas still has the highest rate of uninsured. So,
that's probably true.
Yeah, that's what I thought.
And you're true, because we also you have to think about our type of Texas versus other states have a workforce that consists most of employees working for small employers. Most small employers don't have large insurance packages. States, northern states, midwestern states, have larger employers. They have a lot more insurance. If you look at the TDI presentation done a couple of years ago back, they do a pretty good job of profiling. Our workforce is significantly different, and that's one reason why part of the reasons you have the large uninsured.
Well, thank you for clarifying. I just didn't want to leave anyone out there with the impression that our population numbers were higher for uninsured because of our immigrants.
They contribute to it. They're one of many factors. Thanks for correcting me.